everybody, and welcome to today's episode of Let's Talk About Health. I'm your host, Madeline Mant, and I am super delighted to introduce our guest today. This is Fatema Ali, who's going to join us to talk about her work as a health researcher. So welcome to the show, Fatema.
Thanks for welcoming me, and thank you for having me today.
Of course, I've been really excited to talk to you because I want to get in the nitty gritty. What is a health researcher? What are you up to? What's your day job?
I think with like being a health researcher, it falls into so many different categories and so many different disciplines. But for me, I think it means like asking questions about health. So for me, like I've had the opportunity to be involved in various projects, and my specific focus has been on diabetes. So I started off my journey in my master's, where I did a project looking at how Black women with diabetes experienced the pandemic and also broadly healthcare. So that was my first experience with doing health research. And then I had the opportunity to be involved in other research projects that looked at how individuals with COPD experience transitions in care, as well as family-centered care as well in a CHC, in a rehab center. And I worked closely with registered nurses to develop a project. And that was also very much focused on qualitative research, which is what my background is in. And I've had the opportunity to work on a larger qualitative project that looked at immigrant and marginalized communities in Peel region and how they experienced the pandemic. And that was very much it was a span of 3 months, but we did 80 interviews. And it was I think health, something I realized through all these experiences is health expands beyond just the body. It expands, I think we intuitively know this, but when you speak to people and you realize how large health can get and wellness, it puts things into perspective. And one of the things that inspired me to go into qualitative health research was that the lived experience piece. And that was something I learned during one of my first med and undergrad courses, where lived experiences and how different people can experience illnesses differently. Once again, very intuitive, but coming from a bio background where you kind of a cold is like a cough, and it's a cough, it's a runny nose, but then expanding it beyond why did this person get the cold? How do they treat it culturally, possibly? How do they treat it biomedically, which is also a cultural type of treatment? So it just that kind of inspired me to ask those questions and ask those critical questions and kind of get a more holistic understanding of what health looks like. And so yeah, that's what kind of led me down where I am at the moment. So my current role is at the Novo Nordisk Network for Healthy Populations. I'm a coordinator of research and network activities, and we broadly look at how the burden of diabetes in the Peel region. So, and also as well as chronic disease. Yeah, and we look at it from a research perspective and introducing initiatives, as well as funding research projects and trying to connect, bridge the gap between academics and community.
This all sounds really fascinating. And I'm hearing that it sounds like there's some qualitative and some quantitative in there. So your day-to-day must be really different depending upon the project you're working on.
Oh, yes, absolutely. I definitely transitioned from my master's and all the other projects I was involved with pre my role at the moment was very much qualitative projects. And then now it transitioned more. I'm working the preliminary phase of the network was very much developing our baseline data strategy. And that involved a lot of epidemiology, epidemiological type of analysis. So yes, very much the quantitative, looking at prevalence rates, looking at incidence rates, mapping different indicators in different neighborhoods. So it was very much a learning curve, but this kind of inspired me to go further down the line of doing a mixed methods approach. We're combining the qualitative with the quantitative.
That's great. And I was really, really inspired by what I was hearing in your sort of first description of a lot of the work you're doing, because you're picking up on a lot of, I know you have a background in some anthropology, maybe this is why, but you were talking about questions and words like health and disease and illness and wellness. So can we talk a little bit more about how you think about those words and how you engage with those words in the work you're doing?
Yeah, I think as I mentioned, when I first thought I initially started my journey in undergrad, wanting to go straight into medical school. I was planning. I did my bio, like I did my undergrad in biology, and I was like 3 years, I'm gonna go straight into med school. That was my plan. But then like I took some med ant courses, and that kind of like it derailed me in in the best
Yeah.
way possible. And I was shadowing a doctor at that time, like that time as well. And it just kind of put all the pieces together where you can't treat like if there is an illness or if there is a health concern, you can't, or like even looking at wellness, like you can't look at that without looking at the person that it's within, and also the society that they like live within, the culture they're in, the people they interact with, the systems they're in. So I think with health, for me, like health, like wellness, like all those things are, I think they're more of like concepts that are very much individualized as well. And I think this kind of also goes back to my, like, one of the key aspects to my work is looking at intersectionality. So knowing that like wellness might look a certain way for me, and it might look a different way for somebody else. Like illness might look a different way to somebody else, and it might look a different way to me. And I think it all comes down to what is the difference from your baseline? Like when you feel the best, like when you feel like personally, like the way I feel the best might be different than the way somebody else feels the best. So I think, and then like it being better or worse, once again, it varies from person to person. And it's very like not, it's kind of vague, but I think it makes, it's the beauty of like an individual's experience with health and their individual relationship with health.
Absolutely. No, that sounds really holistic. And it's really interesting to hear you talking there about starting biology, having this very strict plan and timeline, finding yourself kind of changing because of the classes you're taking. So my last question actually is about following in your footsteps. If there's a student out there that's thinking like, wow, I really want to get involved in some health research, what was your journey to that outside of what you've already told us about? And what advice might you have for a student with those interests?
I think my one like suggestion is always like take any experience that you can get. I think like during my undergrad, like I was really passionate about biology. So I did a lab like based thesis, and it's very different than what I'm doing at the moment, but it taught me like very much transferable techniques that I applied, but it also showed me what I didn't like. So sometimes you have to take those chances and actually take all those summer research opportunities, like email your profs, like ask them if they have any projects that they might need a research assistant for. And even if it's something that you might think that you are not interested in, you might surprise yourself, and you might actually, it might spark something in some way that you might not expect. So yeah, so I would say take all the opportunities. Don't get too discouraged. Like I remember I getting my thesis position that I got during undergrad. I sent like I think maybe like 40 emails to different profs, like asking them questions. And even like when I was applying to graduate school, like I sent I think at least like maybe like 70 emails. There's some profs that got many emails from me about like inquiring about their projects and if they were taking any students. So yeah, so take all the opportunities that you can get, and don't get discouraged if there is if there aren't responses. But yeah, I guess like that's kind of like what worked for me, and being okay with the unknown. Like when I was taking the leap from going from like biology to medical anthropology for my master's, I was not like, I didn't know a lot of people that did that path. And a lot of people asked me like, what are you going to get out of this? Like, what are you going to do if like med school doesn't work out? And I kind of was like, I'm doing this because I'm interested and passionate in it, and I'm hoping it's going to work out. And I'm glad that it led me to a position now that I get to continue the work that I'm doing. But being okay with that, you might not have all the answers at hand, but taking the steps to doing the work that you're passionate about, and that kind of inspire you to continue down that path.
Well, thank you for sharing your time with us today and your expertise, and also that really good advice, just this really good life advice, even outside of wanting to become a health researcher. I'm going to take some of that with me as well. So thank you, Fatema, so much for your time.
Yeah, thank you. Thank you for having me.
Of course. And thank you also to our audience for watching all this way with us and for joining us today. And we will see you next time on Let's Talk About Health.